Welcome to the Counselor Soapbox video channel. Today's episode, Drug Counseling Part 3, Clinical Evaluation. Clinical evaluation can include a number of things. We've talked in the past about screening, but this is deciding if the person is appropriate for your program and if they will be acceptable to you. Other parts of clinical evaluation include assessment, crisis intervention, does the client need detoxification, ruling out medical issues, ruling out psychiatric problems. Evaluation is done at multiple points in the treatment episode. There are a number of things a drug counselor needs to learn about assessment. Assessment may mean different things to different people and in different contexts. Assessment can be thought of as a form which is completed by gathering information from the client, but assessment is also a process or procedure of getting more information. Assessment is typically done at the beginning of treatment and guides that treatment episode. But assessment is being done by the counselor every minute of every session with the client, and should new information become available, it may be necessary to update the plans that are produced for treating this client. Assessment identifies and evaluates a number of things about the clients. It should identify strengths as well as weaknesses, problems, and needs that the client has. All of this information, which is gathered during assessment, is used to develop a specific treatment plan, individualized for each specific client. Tab 21 gives us a definition of assessment. Assessment is an ongoing process through which the counselor collaborates with the client and others to gather and interpret information necessary for planning treatment and evaluating clients' progress. The assessment process begins with the very first contact, and it should be ongoing throughout the treatment process. Counselors assess so that an accurate diagnosis can be made. Assessment and diagnosis leads to a prescription of the appropriate treatment. Assessment identifies a number of critical issues. These should include suicidality, any treatment interfering issues, and any relapse considerations. Also, the assessment should look for barriers to treatment. There may be some reportable issues. Reportable issues are exceptions to confidentiality and should have been covered in the intake or informed consent part of getting clients into treatment. There are three primary types of assessments. One is a structured assessment, such as the MMPI-2, the Minnesota Multiphasic Inventory, second version, which is a lengthy questionnaire, over 550 questions, which can then be machine scored in order to determine certain patterns. A semi-structured inventory, such as the ASI, Addiction Severity Index, or Biopsychosocial Inventory, consists of questions to be asked, but when the interviewer gets yes answers to some questions, they will follow up by requesting more information and write that information into the comments section. In drug and alcohol counseling, the best assessments typically are the ones which show a number of comments in that comment section, indicating the assessor got more information. An unstructured inventory or interview is simply a conversation between the client and the counselor, and then that information is recorded In that type of unstructured conversation, you can always go back and ask more questions about things that you need to know. What are the major life areas to assess? Well, we want to know if any of these areas have been affected by drug or alcohol use. So often we begin with a substance use history. When did they first do what drug, and how did that progress to other drugs? We also want to know about psychological functioning and current levels of functioning. It's important to take an educational history to know how far they got in school and whether drugs and alcohol played a role in that educational history. We also need a vocational history. How have they worked and at what kinds of jobs? And their financial status. Also, it's important to assess for legal status. Have they been on parole, probation, have certain crimes which may interfere with their ability to get jobs in the future? What you're looking for is how many of these areas have been affected by their use of drugs and alcohol. Other things that are assessed for using the ASI would include a social history. You look at their relationships with their family, family of origin and current family, and their friends. It's also a good idea to assess for spirituality. Do they have a religious or spiritual faith or tradition, and are they practicing it? Drugs and alcohol affect people's physical health. Physical health issues may predispose them to use certain drugs and alcohol. You want to know about those physical health needs. And you want to know about activities of daily life. How have they been affected by substance use? It's easy in doing an assessment to focus only on the client's weaknesses, but it's important to also look at client strengths. What are the assets that they might have that would be helpful in recovery? One way of looking at this is to ask the exception question. Are there any times when this problem is less of a problem? Were there any periods in their life where they did not use drugs? How have they coped with life events in the past? And you also assess for the status of their life skills. What things are they good at, and what things do they need to develop? Two other things are important when assessing for strengths and weaknesses. One is to look into the topic of resiliency. How have they bounced back in the past? Also, there's a thing called assessment therapy, which says telling the client what you think about their problems can help them to start making changes. The term collateral is often used in counseling, and it can have two very different meanings. One definition of collateral is getting more information about your client. That might involve talking to significant people in their lives, talking to family, talking to their partner, for a child or someone who's in school, getting information from the school. If they're referred by an outside agency, parole or probation or CPS, you might want information from that agency. Also, you may need to consult with their doctor or psychiatrist, or even with a previous counselor or therapist. All of this helps you gather more information to know how to be helpful to that client. Another meaning, though, for collateral is when you do a collateral session. This is when you have the client and someone else in the room, but the focus is on counseling the client and on helping the family and the friends know how to help that client. Does having a collateral session violate confidentiality? Well, it could. It's important not to simply bring a client's partner or family member into the session and begin to tell them why they need to change. What you want is to make sure that your client is okay with having other people in the session. It may be a good idea to get releases of information or consent to release information. And you may or may not be able to get a discharge summary from a previous provider, but often knowing what happened when they were in counseling or therapy somewhere else and why that ended can be very helpful to you. The drug and alcohol counselor needs to know a little bit about diagnosis. The criteria for diagnosing that's most commonly used is the Diagnostic and Statistical Manual of Mental Disorders. The DSM-5 is the most current edition at this time and is published by the American Psychiatric Association. Alcohol and other drug counselors should be very careful to stay within their scope of practice. While they may see characteristics in their clients which appear to be criteria for other diagnoses, such as depression, it's not within the scope of practice for a drug and alcohol counselor to be diagnosing those issues. The DSM diagnosis also include a number which is converted to the International Classification of Diseases. The counselor may also have to use a CPT code for billing, which is the procedure they used in diagnosing. It's also important for beginning counselors to know that they should not use that what used to be the V7109 no diagnosis code. You don't record no diagnosis if something is outside your scope of practice and you're not able to diagnose that. What you should use instead is a diagnosis deferred code. Substance abuse counselors work within the scope of practice of the things listed in the chapter on substance-related and addictive disorders in the DSM-5. For each drug on the list of diagnosable drugs, there are several categories. You could be diagnosing a blank use disorder. You could be diagnosing that the person is intoxicated and under what specific drug. Or the person could be withdrawing and then a specific drug. There can be other blank, whatever the drug is, induced disorders, long-term problems caused by that use of that drug. And there are unspecified, again, whatever the drug is, related disorders. Each of those blanks have to be filled in for the specific drug using a fairly limited list of drugs. The DSM-5 provides for a limited number of categories into which the drug of the client is using has to be placed. These categories include alcohol, caffeine, cannabis or marijuana, PCP or phencyclidine, other hallucinogens, inhalants, opioids, sedative, hypnotic, and anxiolytic. Stimulant drugs are divided into three ways: amphetamine type, which includes methamphetamine, cocaine, and other or unspecified. Tobacco is a separate category. And lastly, there is a category for other or unknown substance use disorder. The chapter in the DSM-5 which covers drugs and alcohol also includes some references to non-substance related disorders. Currently, gambling addiction is included in this category. No other behavioral addictions are recognized at this time in the DSM-5, but there are some close relatives which are found in other sections: impulse control disorders, sexual disorders, and hoarding, as well as OCD type disorders. In the back, and under conditions for further study, are things like internet gaming disorder and neurobehavioral disorder associated with prenatal alcohol exposure or fetal alcohol syndrome. It's important to note that in Europe, the internet gaming disorder has been recognized as a diagnosable disorder. There's some other factors that need to be taken into consideration in diagnosing substance use disorders. Currently, we are dividing substance use disorder into categories: mild, moderate, and severe. I think this is useful rather than arguing over whether the person is a drug addict or simply abusing drugs. We can indicate that addiction or addictive substances and their use can fall on a continuum. There are also specifiers for the course. Is the use in early remission, or is it in sustained remission? Are they abstinent from drugs of abuse while on maintenance therapy for using some other medication? And has their abstinence only happened when they are in a controlled environment, meaning in jail or prison or somewhere where they are not able to freely access drugs? In using this new system of classifying disorders, substance use disorders, on a continuum, words that have dropped out of our language are the use of the idea of addiction or dependence and abuse. If when someone uses a drug, they have a problem, that is diagnosable as a substance use disorder, regardless of whether it fits the definition of addiction, dependence, or abuse. Most drug and alcohol programs use the ASI, Addiction Severity Index, in assessing clients' issues with substance use disorder. This is a licensed or proprietary assessment, so I'm not going to show it here, but it's important that the beginning counselor become familiar enough with it that they could complete one if needed. This is available both in a paper format and in a computerized version, covers many of the areas we've discussed in this video about assessment. What's ahead for the Counselor Soapbox video channel? More in our Learning About Drug Counseling series, more drug education videos, and a series on mental health and wellness. If you've enjoyed this video, please click the like button directly below. For more information, please visit the CounselorSoapbox.com blog, where you will find articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are available on Amazon.